Hormonal shifts influence the brain, the nervous system, sleep quality, stress tolerance. A woman may suddenly feel more anxious, less patient, because this often happens in the middle of a very full season of life with work, caregiving, family, accumulated stress. Sometimes it's not one dramatic symptom. It's more that the whole system feels less forgiving. They used to bounce back from now hit them harder. That's often how women describe it. Everything feels harder than it used to. Hello, everyone, and welcome back to Medicine with Meaning. I'm Dr. Julie Ta, and I'm so glad you're here. So in recent episodes, we've been exploring the different ways our bodies and lives begin asking for change during midlife, from energy shifts to connection, and of course, nervous system support. Today, I want to talk about something that many women are experiencing, but often don't fully understand until they're in it. And that's the topic of perimenopause. This phase can bring changes in mood, sleep, energy, metabolism, and how your body responds to stress. And yet so many women are told that what they're experiencing is just part of getting older. My hope today is to bring clarity, reassurance, and a better understanding of what's actually happening in the body during this transition. Let's dive in.
Dr. Julie, it's nice to see you again. Let's start with the basics. What exactly is perimenopause and how is it different from menopause?
Perimenopause is the transition leading up to menopause. It's the phase when hormone patterns begin shifting, especially estrogen and progesterone. But cycles have not fully stopped yet. Menopause is technically reached when you've gone 12 full months without a menstrual period. What's important to understand is that perimenopause can begin years before menopause. And during that time, women may already be experiencing symptoms, even if they're still getting periods. That's part of why it can feel confusing. You may still be cycling, but your body is no longer operating the same way it used to.
What are some of the earliest signs women may notice even before their cycles begin changing significantly?
So for many women, the earliest signs are not always the obvious ones. It may not start with missed periods. It may start with for instance, sleep feeling lighter or more disrupted. It may be irritability or more anxiety. Some women may feel less resilient to stress. Others may feel more PMS, more fatigue, or changes in body composition. And some may just feel like their system is suddenly less steady. Some women notice they're more reactive. Others feel more depleted. Or some say, I just don't feel like myself, but I can't explain why. So these changes are often the beginning, and these shifts can be very subtle at first, but they're certainly real.
And so you've mentioned that menopause is considered after you have 12 months without getting a period, right? And how would you know when perimenopause is starting? Is there a way to measure that?
So there's no real blood test to measure perimenopause. There may be some shifts in the hormones and you can measure that. Typically progesterone levels start to decline and that may be an early clue, but it doesn't diagnose, oh, you're in perimenopause. If periods start becoming irregular, let's say, you skip a period or maybe you go 6 weeks, without getting a period, those irregularities can be another sign. But you can experience all of those symptoms I just listed even before you miss your first period or before menstrual irregularities. So there's no actual way to know, oh, this is perimenopause, except it usually happens in your 40s. It can happen earlier, but that's usually an outlier. But I would say, if you're in your 40s, especially mid 40s, this is the typical time period. And if you're experiencing, some of those symptoms that I just listed, that is very likely perimenopause.
So, why do symptoms like mood swings, sleep disturbances, anxiety, and brain fog often catch women off guard during this phase?
I think they catch women off guard because many women still think of perimenopause as mainly hot flashes and skipped periods. But hormone shifts affect much more than reproduction and our periods. These hormonal shifts influence the brain, the nervous system, sleep quality, stress tolerance, cognition, and emotional steadiness. So a woman may suddenly feel more anxious, less patient, less focused, or more easily overwhelmed without realizing there's a physiological transition underneath. And because this often happens in the middle of a very full season of life, with work, caregiving, family, and accumulated stress, it can be easy to assume, she just needs to try harder. But often the body is asking for a different kind of support. I often say midlife is often the season when the body stops quietly absorbing the cost of over pushing.
And was there a moment in your own life or in your work with patients when you realized how misunderstood this transition can be?
Yes, absolutely. What really stood out to me was how many smart, capable women were quietly struggling and not recognizing what was happening. They would describe feeling more tired, more anxious, less clear, or emotionally stretched, and they often blamed themselves. They thought they were doing something wrong or that they should be able to manage it better. That's the part that feels so important to me. That this transition is often minimized and women are given very little context. And because of that, they can feel confused or even alone in their own experience. One of the most healing things is simply helping women understand this is real, this makes sense, and your body is not failing you.
So, in your clinical work, what are the most common symptoms you see women experience during perimenopause?
The most common ones are disrupted sleep, anxiety, irritability, low or inconsistent energy, brain fog. That's a big one. Worsening PMS can be another. Cycle irregularity, And sometimes it's just, changes in not just the timing of their cycles, but they get heavier periods or lighter periods. Weight changes is a big one. That's very common. And then just women feeling less resilient overall.
Mm.
So a lot of women also describe feeling more inflamed or just like they're more sensitive in their body. And the things that they used to bounce back from now hit them harder. So sometimes it's not one dramatic symptom. It's more that the whole system feels less forgiving. That's often how women describe it. Everything feels harder than it used to.
And I think that one of the things that stresses women out a lot is the weight changes, right? During this time. Is there a reason why that happens, or is it just hormone fluctuation?
Yeah. Yeah. Well, the hormonal shifts impact our metabolic health.
Mm.
And that can impact, our weight, and it impacts blood sugar regulation. It can, cause stress in our body and more inflammation. And I do think, midlife is a very full time, for many women, sort of the peak of our careers. It's a time where our children may need us more, or very common, you have aging parents that have health issues. And so you're caregiving not just for your children, but your parents. So it happens, during a very full time in our life, these hormonal shifts. And then, it's a stressful time, but weight gain is a stressful thing to happen. It's like, it's odd to women. They haven't changed their diet. They haven't changed how they exercise, but, they're gaining weight. Or very common, they can't lose weight like they did in their 20s and 30s. Like what worked then just doesn't work. They lose 5 pounds and that's it. They can't, lose more than that. And it's really frustrating. And that in and of itself, I've seen that stress out many women. It's kind
Mm.
of like, what the heck is going on?
Yeah, if you're doing things right, or what you know to work, it's not working anymore. But is it that part of what we've spoken about before, that is just like an invitation to do things differently, and that's what most women don't understand? It's not that it doesn't work or that you're not able to lose weight anymore, but the way you do things has to change in order for that to happen. It's like the mechanisms work, or there's an actual stop.
Yeah. Well, that's a very good question. And what it definitely means is that you need more support
Mhm.
in this season of life. And yes, you may need to do things differently. So you may need to be more gentle with yourself, and you may not need to push so much. And I think in our earlier decades, pushing got you what you wanted. But in midlife, that strategy may not work, and you may need to allow and meet your body and your ecosystem where it's at. So, it is hard to kind of speak in generalities, but in this instance, you may want to go see your doctor and see what's going on. Do some blood work, measure your hormones, measure inflammation, measure, metabolism biomarkers, things like your blood sugar and fasting insulin. Are you pre-diabetic? So that you can really hone in on what your body is needing. And then it also brings up the conversation around hormone support. In perimenopause, hormones aren't always the first go-to because it's a fluctuation of the hormones. And so it's not that you don't have enough of the hormones. It's just they're all over the place. In post-menopause and menopause, yes, hormonal support may be the right thing for you, depending on your history and, your risk for breast cancer and those things. So it's trickier in perimenopause. And then the other support, besides just really checking in on what's going on in your biological health, right, is all the other parts of the ecosystem, right, that we've talked about. Maybe it's nervous system support. And when you support your nervous system, that's going to support your hormones. Maybe it's boundaries. I just had a conversation with a dear girlfriend of mine where boundaries is something that, may need to be in place. Maybe it's, relationships. That's part of the well-being ecosystem. Maybe it's, your daily rhythm and the environment around you. Maybe it is finding meaning and alignment. One of my favorite topics that we talk about in this podcast. So looking at the other parts of the well-being ecosystem, and it may not just be the hormones. So yeah, it really, you need to look at the big picture.
Mm. And many women assume these symptoms are purely hormonal, like you said, but they might not only be that. So how do nervous system load, chronic stress, blood sugar, and sleep patterns also influence what they feel? Speaking the broader view of things.
Yeah. This is such an important question because symptoms are rarely just about hormones in isolation. Hormonal fluctuations are real, but how a woman experiences those fluctuations is also shaped by the condition of the rest of her ecosystem. So if the nervous system is already overloaded, if she's running on chronic stress, if she's depleted, if blood sugar is swinging, if sleep is poor, if recovery is inadequate, those hormonal shifts tend to feel louder. They amplify those hormonal shifts. And that's part of the lens that I use in my practice. I'm not only asking, what are the hormones doing? I'm also asking, what is the state of the ecosystem that is receiving those hormonal changes? Because when the body is already stretched thin, perimenopause can feel much more intense.
And we touched a little bit on this earlier about how, what used to work in the past doesn't necessarily work the same way during perimenopause. Why does it stop working? Why does it happen where
Yeah.
you're saying I'm eating the same things as I used to, or I'm working out in the same way, but my body's just not responding?
Well, it's because the body is changing. And what used to be enough may no longer be enough or may no longer be the right fit. A woman may have been able to power through less sleep, skip meals, push hard with exercise, stay in that go mode and recover fairly well. Then suddenly those same habits start backfiring. She may feel more depleted after intense workouts, maybe more irritable when she doesn't eat enough. Or this one, more anxious after too much caffeine.
Mm.
Um, and so it feels like there's just less margin. So it doesn't mean that she's doing everything wrong. It does mean her body's asking for a new approach. And midlife often requires more steadiness, more recovery, more nourishment, more listening to your body and what it's telling you. And it really is a time for self-honoring. It is just part of life changes. And yes, our body is less resilient. I know it's hard to accept that part of midlife. I think, in our 20s, you can be downright abusive to your body, and many of us were in our youthful stupidity. Sorry, right? Maybe not you, but I know that I was not always kind to my body in my 20s, and she's like, "Okay, then it's okay, we're good," and your body tolerates that. In your mid 40s and beyond, and certainly in my 50s, I do need to be kinder to my body. And maybe that shift is a good thing. It's like we should be kind to our body. Why not? But in our midlife, our body sort of demands it.
It's like boundary setting. Your body is learning boundaries.
Yes. And that is how you age beautifully, gracefully, with resilience, because you're going to put in place a system where there's this sustainability, and that's true longevity. Treating your body in a way that aligns with what it needs.
Mhm.
That's going to change from season to season. If you have a season that's very stressful, I laugh. It's, all of those midlife moms who are helping their kids with the college application process. That is a stressful period. You're going to have to align with what's needed in that period. And that period ends, it's probably like, I don't know, 9 to 12 months or so. So it really depends on what's needed in your season of life. Not just midlife is a season, but what's happening personally for you in your midlife season. Is it a stressful period? That may require a different strategy than a period where your child's been accepted to college. And it's like, you can exhale. This conversation is happening, in spring, and this is the time when all seniors are finding out their college acceptance and, where they're going to be going to college. So that's why it's on my mind right now.
And Dr. Julie, how long is perimenopause approximately? I guess it varies from women to women, but what's an average, an estimate?
Yeah, it really depends.
Mm.
I think the scientific way to explain that would be if we could measure women's hormones on a, day-to-day basis and see the hormones fluctuating and see how long that lasts, then you would have a precise answer. We do have those tools now available. There are devices where women can measure their hormones. So I don't have a precise answer except that it varies from woman to woman, but that, on average, it could be like 1 to 5 years, maybe longer. And it varies. And some women don't feel any symptoms.
Mm.
Some women breeze through perimenopause and menopause. And why are they so lucky? Very likely because their well-being ecosystem is well tended to.
So you would say that that has a lot to do then, like if people actually tend to their ecosystem, or the earlier they tend to their ecosystem, they may be able to mitigate a lot more those stages of life.
Absolutely mitigate their symptoms. And there's also like a cultural context here. Um, I think if we start, now it's being talked about. We're talking about it in this episode. It's on Instagram and we're normalizing. Well, we're talking about it so it's less mystical. And we're having these conversations, whereas maybe a generation of women ago, it's like they had to go through it alone. They didn't understand it. And that, it's normal to have these symptoms and we need to find ways to address them, you know, um, as a society in these podcasts, as well as, finding help, through the support of your doctor. And, menopause is sometimes even more symptomatic because that is a real deficiency in these hormones and that your doctor can support you through that through, various treatment options as well as, a well-being ecosystem approach. And so there are many ways to support women through this journey. But I think the first step is just to talk about it, understand it, seek support, and that you don't have to be alone through this process. And it doesn't have to be a scary journey. I find it very empowering. Of course, I'm on the other side now of menopause. I'm now post-menopausal, and I find this season of life just delightful. I just find that I've really come into my own as a woman and that my hormones are no longer fluctuating and I feel pretty steady. And I'm learning to tend to my well-being ecosystem. And that's been a journey. In fact, this podcast has been helping me understand what I need to tend to my own well-being. And, that's a lifelong journey as each season of life changes our body and then we have to adapt and align with it. But the foundation is listening to your body, listening to those signals and understanding what they're saying and having awareness of what is needed. And when we tap into our wisest self, those answers become evident. Well, let me just say that in my own journey, I am learning to tap into that wisest version of me, and those answers for me are becoming more evident. And, that is sort of my mission, is to help women do that for themselves. And sometimes we need the guidance of a doctor, when it doesn't make sense. But I think each of us has that wisdom, and that's going to be, a new goal that I have for this podcast is just, helping each of us tap into that wisest self. And she's there. We just have to learn to make time for her and to listen to her. Oh, that was a little bit of a tangent there.
No, it's really beautiful that you mentioned all these things. And I think especially the fact that we're able to speak about this nowadays, because like you said, so many women before us were kind of hiding this. It was kind of like there was shame also around it. I remember even my friends being like, "Oh, you're in menopause, mom. That's why you're being so mean." And that's kind of what happens when you're younger as well. And boys are, they're like, "Oh, she's in her period. She's being so mean." Like there's this stigma towards this phases of development in a woman. But if you think about it, we've gone through it over and over again. Like when we were getting our period for the first time, we were going through changes as well, and our bodies adapted. Like what was working when you were a kid was, we were changing so much as much as people in perimenopause are changing as they're.
Oh, for sure. that's another period of hormonal
Mhm.
fluctuation, right? The start of our periods and getting used to our periods. You just said something that just touched something in me. It's like, you're right. Our periods have been so taboo, and it was a way to like shame girls, and we didn't talk about it. And then menopause is another time of shaming. And I want to flip that script and really bring to mind that it's because of our periods and our hormones that we are such powerful beings. We create life through these hormones and our uterus, and it's like we give life. And so yes, these hormones sometimes give us symptoms, but it is so empowering, and I want girls to know that, and women, like, this is what gives us our power, our ability to create life. And, that's a cool thing. Anyhow, I just had that little aha that we need to change that script, and that we need to be proud of our period and our hormones, because it's what allows us to give life.
Yeah, I was gonna say, yeah, like it's something to be proud of, not to be shamed of. And
Yeah.
as we talk about it and we become aware of the power of this, then changes can even become exciting, because it's an opportunity to find new ways to adapt rather than become scary, because we don't know what to do. But now we know we're changing. How awesome. Now, what do I need to do in these to accommodate to these changes? Because I think that we live in a world where we've been accustomed to accommodate to what's going on. But speaking onto that pride and that you mentioned about, we're women, we have these changes, we have this ability to create life, then we have to let the world accommodate to that beauty as well, to those beautiful changes that we go through as women.
Yes, that's so right. And it is all about change, and perimenopause and menopause is another change of the hormones. And, I just had this insight that we have that life-giving ability, and we do lose that in menopause. And yes, it's a bit of a loss, but then it becomes life-affirming for ourselves. And I think that's what I'm feeling right now. Not that I'm still not caregiving for my children and my family, but it's almost a time where it does force you to pay more attention to yourself and your body. Remember, because your body is less resilient and you do need to pay more attention. But it's really a time of that self-honor and self-love. And so, you give back life to yourself. And I think that's what I'm feeling right now. It's like, yes, I do have to really deeply care for myself, and it's a beautiful time. And that, it, because you're not so life-giving to everyone else, you're able to give back to yourself. You need to give back to yourself, and that's what midlife changes does ask of us. And so it is a beautiful time. And I think if you talk to a lot of women in menopause, they all say this. It's like, now it's about giving back to myself, because you're kind of done. And, I'm a bit of an older mom, but most women in post-menopause, their children are going off to college, or they've graduated in many cases, depending on when you had children. And so it's really less about that active caregiving of children, when your children go to college. So it's kind of a beautiful time for many women, and that, we shouldn't be afraid of menopause and then perimenopause. They're just part of the natural life changes that are part of this beautiful journey of being a human being.
Perhaps there is a little bit of grief, as you mentioned, like you're letting go of that ability to give life outwardly, but now it's like you're entering a time of replenishing. So maybe perimenopause can be that period of like you're getting ready to let go of certain parts of yourself or
Well, I think, you're absolutely right. There's this grief, right? Maybe not even that much grief. Some women are like, huh, I'm happy to get rid of my period. But, yeah, it is also a sign that you're entering a new phase of life. And, I would say that, in that giving back to yourself, you're able to focus on yourself, and perhaps you have more space and time to tap in with that higher version of yourself. And I think, when you're so busy, doing all the things that we do up until that point, there's like no space for that. And so I'm really appreciative of having more time and space to focus on myself and connect with that highest self version of myself. I think I'm really, deviating from the topic of perimenopause, and I went into menopause. Sorry about that. But I just don't want, what I want to share is don't be afraid of these changes. And, though I know perimenopause is hard because it's just, fluctuations of the hormones and it feels so unsteady. But with the right support, you can get through it.
and going back to the ecosystem, Dr. Julie, can you tell us how does perimenopause highlight the importance of supporting the whole system rather than focusing on hormones alone?
Yeah. Well, it's like you can't control your hormones in perimenopause unless you get on hormone replacement therapy or, get hormonal support. So let's say you don't get hormonal support and your hormones are fluctuating. Then you really try to support all the other parts of the ecosystem that you do have control over. So, nervous system regulation, doing breath work or meditation or yoga, whatever, or taking a walk to regulate your nervous system. Your daily rhythms, you can control your rest and your work rest cycles. Your, sleep, making sure you're on a good circadian rhythm for sleep. What else in that ecosystem? Your relationships and boundaries. That's important to tend to. I think, for busy moms, putting boundaries in place for our families is one place. I think for busy women, adding more is always not the best strategy. It's like, I can't give my busy moms one more thing to do, but perhaps, subtracting or putting up a boundary is useful. And then, finding support where you can in your relationships, right? Leaning on those people that you can lean on. And, meaning, which is, the title of our podcast, finding meaning, which is, connecting with what matters to you in your life. And of course, relationships, loved ones, that's one area we find meaning. Or whatever it is that matters to you, connect with that. So those are the ways in which you can work on the other parts of the ecosystems beyond just the hormones.
And just to narrow it down a little bit for our listeners, what are some of the most supportive things women in perimenopause can begin doing to stabilize their energy, mood, and nervous system?
Yeah, I love this question. I love the idea of supportive, right? We need to find ways to support our well-being, and I want to make it practical to help stabilize energy, mood, and nervous system. So, First, stabilize nourishment. And what I mean by this is eat consistently, prioritize protein. Protein is, so important, but it's also very grounding. It's important to stabilize our blood sugar. Okay, so eat in a way that stabilizes our blood sugar. And so protein can help support that. And of course, eating less simple carbohydrates and sugar. And so this allows us to not run on fumes, right? Yeah. Skipping meals is running on fumes. Second, protect sleep more intentionally. Even if sleep is not perfect, the body does better with more rhythm and more recovery. So protect sleep intentionally. Third, reduce unnecessary overload. So that may mean, less intensity, maybe that intense workout even, less multitasking, less stimulation. So maybe less time on your phone, certainly social media, and creating a more realistic pace. So this is that subtraction that I'm talking about, right? Reducing unnecessary overload. Fourth, supporting nervous system. And I want to keep this very simple. So do what resonates for you. And it could be breath work, could be just a 10-minute walk outside, or just a moment of quiet. It may be just like transitioning between roles, so especially for the working moms out there, before you open the door of your home, maybe 3 intentional breaths, whatever it is, so that you can like decompress from work and then enter mommy mode. So these are ways to support nervous system. And fifth, this is very important. Stop interpreting every symptom as a personal failure. So this transition in perimenopause calls for care and not self-criticism. So I tried to give 5 kind of easy steps. I know there are a lot of pieces to each step. Pick one, and maybe just start with one step that is doable. And the key is to not do more, but to do what feels like the next best step for you.
Dr. Julie, we've reached the end of our episode, sadly, but we have more episodes to go deeper into different topics. Before we close, though, is there anything that you would like to leave the audience with?
Yeah. So certainly if you have symptoms, that are confusing or, just don't seem like a normal part of perimenopause, or want to learn more about, perimenopause through the lens of a doctor, I do recommend that you seek medical attention. It'll be helpful to do that deep dive. I also want to share that this is part of what we explore inside the Wellbeing Ecosystem program. I think many women arrive feeling confused by changes in their bodies, their energy, their emotional resilience. And together we look at the bigger picture, supporting the biological, nervous system, and daily rhythm pillars so that this transition feels more understandable, more grounded, and less overwhelming. Because perimenopause is not something to simply push through. It's a phase to meet with better support, better understanding, and more compassion. So I'd love to stay connected with you beyond this episode. If today's conversation resonated, come visit my latest posts on Instagram at julie.taw.md and leave the word harmony in the comments. Think of it as a small check-in with yourself and a way of acknowledging where you are in this season.
Thank you for joining us for this episode of Medicine with Meaning. Perimenopause is not a problem to fix. It's a transition to support with understanding, compassion, and the right kind of care. If this episode resonated with you, share with someone who may need it. And we'll see you next time.